Go ahead, you can start anytime.
My name is Stephen Miller, and I'm a licensed paramedic, and I've been doing EMS since 1993, December 93. And my counterpart for this class is Mr. Oscar Cortez, and he's been a paramedic for, you've been in EMS almost as long as I have.
Yeah, almost 20 years.
Yeah, almost 20 years. So we got almost 40 years of experience between the two of us. So, or right at 40 years. We've been doing EMS a long time. A lot of his experience has been not only on the truck, but in the hospital. So he brings a different aspect to the classroom because he's actually worked in the hospital. Hospital medics get to do a little bit more of some things, and a little bit less of the others. But you know, all in all, it brings a different aspect to the classroom. So it's the same thing, same field, just different areas of work. So mine has been mostly on the truck, mostly in Cameron County. Brownsville, Port Isabel. I do a lot of water rescue stuff. I've done a lot of, well, I haven't done the water rescue. I've done a lot of, when they bring them to me, yes. I've done a lot of drowning cases. But anyways, this is the EMT intermediate course. Before they got here, they had to do another semester, which is called the EMT Basic. The program is actually divided into 3 levels. The EMT Basic, which is 1 semester, and there is no restrictions on who can get in. Okay? It's an open enrollment. All right? Now, not everybody who enrolls in our program is successful. Right, guys?
Yes.
So, not everybody is successful. We want everybody to be successful, but not everybody will be successful. And the basic program is just exactly what it says, basic. It's first aid on steroids. So if you've ever taken a first aid class, we're just going to add to that. So it's a lot of bandaging, a lot of splinting, some medications, not many. It's just basic. Pretty much what it is basic. A lot of anatomy and physiology at every level, whether it's the basic or the intermediate. So we start you off in the basic. The intermediate, though, guys, that's when it really hits the road. You know, because that's when we start the advanced skills. That's when we start the IV administration, the sub-Qs, the IMs, the intratracheal intubation drug administration, IOs, interosseous infusions, and so all that good stuff. And they get a lot more medications. And now their medications aren't just the basic over-the-counter medications like oral glucose. Now we're talking about D50, 50% dextrose and water, which is injected in the vein. Okay, so we have a lot more medications. Plus, they get the extra skills. One of the extra skills is one of the ones they're doing today is pediatric endotracheal intubation. So it's advanced airway for pediatrics. So we have a lot of more skills to do at the intermediate level. It's another just 1 semester, guys. It's just 1 semester more. And then you're ready for the paramedic. So if you're successful at the basic level, successful at the intermediate level, then you can move on to the paramedic level. Paramedic level is 2 semesters. You have to pass semester 1 in order to go to semester 2. All right? If you don't pass semester 2, then you have to wait a year till the next September when we start another paramedic class to take the semester 1 again. So just do what it takes to pass. Study hard. Is there a lot of reading, guys?
Yes.
Is it hard?
Yes.
It's not easy.
Huh?
It's not easy.
It's not easy.
Just like
It's
anything,
not easy.
just like anything else.
I wouldn't say it's hard. It's just
Challenge.
tedious. There's a lot of work to it. It's not hard work. It's just tedious work. You got to be able to read. Got to be able to understand what you're reading. You got to be able to understand the lectures, and you got to be able to recognize when you need help and go to tutoring appropriately. So hint, hint, guys. So it's not really that hard. It's just tedious. The paramedic I found very challenging because of all the medications. Because in the paramedic level, now we're going to go even further. We're going to take those advanced skills you learned as an intermediate. We're going to put more of them on there. You're actually going to learn how to do a surgical trach, chest tubes, chest decompressions, suturing, a lot of other stuff as well. And about 75 meds that you have to pretty much know backwards, forwards, inside out, back, up the backside of it. You gotta know everything there is to know about it. Those medications, you have to know them. You can't get away without knowing them. And not only for adults, but for pediatrics as well. So, it's a lot more difficult. I found it very challenging, some aspects of it, the pharmacology part, and the special populations where the pediatrics come into play. I found that pretty challenging as well, because special populations deals with everybody that's not a normal adult between the ages of 16 and 65. Everybody outside that range is where it takes place. All right, so special populations was pretty tough, but it's doable, guys. It's very doable. How many of y'all are wanting to go into the nursing program? We have a bridge program from paramedic. You get your associate's degree in paramedic, and you can transfer into the RN program. So they have a special track. What's cool about that special track, instead of being one of 300 trying for 100 something spots, you're one of 60 trying for 50. So your odds of getting in are better. A lot of people come to us because they've tried the traditional route of getting into the RN program and found it quite difficult, and they've been spinning their wheels, and it's like, okay, I'm just going to go through the paramedic program and then go into the RN program. And they've done that, and they've been successful at it. And now they're both paramedics and RNs. So when you add a dual certification to your name, you know, that's even better. I don't have a dual certification. I'm a licensed paramedic. That's what I do. Actually, I'm a licensed paramedic and an EMS instructor. So I guess I do have a dual role. Mr. Cortez, not this Mr. Cortez, but the other Mr. Cortez, Mr. Henry Cortez, he's both RN and paramedic. So that makes him more marketable. We have another instructor here who teaches at the paramedic level, and he's an RN paramedic as well. And he works in the ER at Rio Grande Regional Hospital, as well as teaches here. So it's doable. It's easy to get into that way. And if you're willing to do what it takes to pass, it's doable. Okay. We have an instructor that's finishing his med school, and one of the students asked him, "Is it hard to be a doctor?" He says, "Not if you're willing to work for it. You just have to be willing to say no to things and study and do what it takes to pass." It's diligence, not brain power, that makes you a doctor. It's that diligence. And it's the same thing with everything you do in life. It's your diligence. How much are you willing to do to get it done? So, and that's all it is. Any questions? Guys, I've been to college before, and I know what it's like to be in college. Honestly, I really do. And it's not the easiest thing in the world to do. But to get through it, you just got to remember this one thing. The next 2 years, the next 3 years, the next 4 years, however many you're going to plan on spending in college, that's pretty minute to the 80-year lifespan you're going to have. That 4 years of your life is pretty small. It looks like it's, oh, this is terrible. It's actually not that bad, and it's only 4 years out of 80. So you got 76 more years to live, outside of college. Okay, you look at it. You spend 16 years in school between high school, grade school, high school, college, university. You got 16 years of school. Out of that 16 years of school, think about it. You still have how many more years left to live? Life expectancy of a person in the United States is about 80 years of age. So, wow, that's not very many years to spend in school compared to what you're going to have for the rest of your life. Okay? And one thing Mr. Cortez said earlier today that I found really, really enlightening, and it's true, and we all know it, but the one thing they can't ever take away from you is what you've learned. Your education. No one can take that away from you, ever. What you learn is what you learn. It's with you forever. So it's really important that you learn as much as you can while you can. And we're still learning. I'm still learning. Mr. Cortez is still learning. The other Mr. Cortez is still learning. Our program chair, Dr. Gonzalez, is still learning. Everybody's still learning on a daily basis, because medicine is what?
Always evolving.
Yeah, always evolving. It's a what was it, about 30 days ago, no one ever thought Ebola would be in the United States. And now it's here. Now we got to evolve. We got to change. We got to change the way we do things. Why? Because once that disease is here, it doesn't go away. It's not going anywhere. It's here to stay. So we beat it this time. 10, 15 years down the road, it's going to erupt again. And we may lose thousands of people. But, you know, that's just the way life is. I'm not as worried about it. I'm not as worried about, my students know which disease I'm worried about the most. I'm not worried about Ebola. I'm not worried about HIV. I'm not worried about hepatitis C. The one that scares me the most is tuberculosis. Because if somebody in this room has tuberculosis, guess what? We've all been exposed to it. Because it's airborne. It's from the air you breathe. So you go to HEB or Walmart and somebody's coughing a bunch and little sputum's going all over, and they have tuberculosis, guess what? You do now too. It's the only disease in the country you can be arrested for not being compliant with your medications.
Where can you work as an EMT?
Where?
Burger King.
What did he say?
Burger King.
Burger King. You can work, of course, the traditional EMS. You know, you can work on the ambulance. That's the traditional thing. You can also get hired in ER as an ER tech. You can also work in industries. A lot of industries are hiring EMTs to work. You can work as a 911 dispatcher, because like almost all the 911 dispatchers now are EMTs, and they're called EMRs. No, what are they called now? The dispatchers, emergency medical dispatchers, EMDs or whatever it is. Yeah, emergency medical dispatchers. And what they do is when you call 911, if you get one of those people, they're going to tell you what to do. Oh, okay, this is what's happening. Okay, you need to do this. They got an excessive fever. You got kids, excessive fever, seizure. Okay, you need to cool them down. This is how you're going to cool them down. Da, 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 da. And they're going to talk the person who's calling through the emergency until EMS arrives. The whole time they're sitting there telling the person on the other end of the phone what to do. They're typing out the deals. So the medics get their dispatch orders, and it's like, oh, okay, we got to go there for febrile seizure of a 3-year-old. Okay, cool. You know. And that's a thing that is big, and it's up and coming, and it's a lot of places have it already. And I know Hidalgo County's gearing up for that. Medicare already has it. Their dispatchers are all emergency medical dispatchers, and they give advice over the phone. It's all on a little card. They read it off, but they're all EMTs. You have to be at least an EMT or better to do that job. So if you're bilingual and you can stay calm in somebody else's emergency, me, I'd be like, would you quit yelling at me? I'm sending ambulance now. I'd make a terrible dispatcher, I really would. I'd make a terrible dispatcher. So, but if you have that in you, then hey, great, be a dispatcher. You can also work in, I already said you can work in hospitals, you can work in nursing homes, you can work in industries. A lot of industries hire EMTs all the time. There's a new push now to get all police officers EMT. Pennsylvania is the first state to enact it. All their police officers now have to be EMTs. And all their medics have to be tactical medics. They all have to go through tactical training. Because these things like what we heard about in Ottawa yesterday, and that guy jumping the fence in Washington at the White House, and all the things that have happened in the past, they want more people in the public ready to act for those kind of emergencies. So it's an ever-changing thing, and someday we'll look back on this time of terrorist activity and disgruntled employee activity, and we'll laugh about it because we'll have moved on from that. Okay, things run in cycles constantly. So there's all kinds of job opportunities for EMTs. They're fixing to build a space launch system over here in Brownsville. I guarantee they're going to be hiring medics for those launches and those EMTs. Oh yeah, and air evac. We have air evac for our paramedics and our paramedic RNs. Most of the RNs and the paramedics that work over there are both trained both ways. And this is the other Mr. Cortez, Mr. Henry Cortez. He's the RN paramedic. So there's a lot of opportunities. Yes, ma'am.
So for those that get do the transition from EMT or paramedics to nursing? Do they get, I guess, a higher salary, or do they just start at?
It's
the
gonna depend on where
entry
you go work. A lot of
Okay.
places will pay you for extra certifications that you have. But the thing of, go ahead.
I'm sorry. Another added benefit to having those two certifications, as Mr. Miller was saying, is not only the extra pay, but it opens the doors to other places within nursing that you normally wouldn't be going into as a new graduate. As a new graduate nurse, just like in any other field, you have to start at the bottom. You know, work the shifts nobody wants, work in the places nobody wants to work in, and build yourself at some experience and knowledge, and then you get the chance to go into other departments. Being a paramedic RN, it opens the doors to some departments, some areas of the hospital where typically a nurse who wants to work in that area is required to have a minimum of 3 to 4 years of experience, have extra certifications that as a paramedic you probably already have, and of course with that comes better pay. One of the added benefits to that also is that the hospitals pay you per years of experience, whether you're a nurse or a paramedic. Now, some hospitals will be, flat out pay you year per year. I mean, if you were a paramedic for 5 years, they're gonna consider that as a nursing experience and give you the added benefit of that 5 years experience in pay. You know, what does that mean? That means you're gonna get paid more than what the minimum pay would be for a starting off nurse, right? And of course, added to that, your experience as a nurse. So you could be starting off with, let's say 8 years of experience all total, paramedic and nurse, and that's gonna mean a lot more money than the nurse who just started, her career or his career as a nurse. So there's a lot of added benefits. Places, for example, the acute setting situations or places, ER, ICU, post-op, those areas, typically they want experienced nurses. They want people who've been in that similar type of setting for 3 or 4 years. They won't just hire someone fresh out of school. Yes, you may know the latest information, but you don't have the patient experience. As a paramedic, you have all that and then some, plus extra certifications, and they want all that. In other words, they won't have to educate you and spend more time and effort with you because you already have it. So they much rather get you than someone brand new or someone who's been working perhaps in some other area who doesn't have any of that. So it does add quite a bit benefit having both certifications.
Mr. Cortez, you're somebody who came through the paramedic to RN track.
Yes.
Maybe you could speak to that, how that prepared you for
Okay.
that program.
All right. As a paramedic, our setting is of course a little bit different. We work in the pre-hospital setting. We work in acute care, emergency. And the knowledge gained as a paramedic, not only in the classroom, but also in the field, helps us with one of the most essential components of medical education period, which is the critical thinking. Critical thinking in nursing, in our field, in any medical field right now, is the biggest concept that we try to teach everyone. Given a situation, given some information, you're supposed to draw from your education, your experience, your knowledge in order to solve a problem, right? We no longer do if you follow steps 1, 2, and 3, the end result should be this. We used to call that cookbook medicine because it's like a recipe. You're trying to bake a cake, you have your ingredients, you mix your ingredients, end result, it's a cake, right? Well, our patients are not like that. Our patients come in different sizes, shapes, colors, different conditions. Their body gets affected by disease or an injury in many different ways. So we got to be able to solve that type of situation. Now, being a paramedic and transitioning over to the nursing, there's also somewhat of a transition that goes within us. And I like to call it that, we have to flip the switch. Because as a paramedic, we're autonomous. I don't have to call in or ask a doctor for permission to do things. I do a lot of skills as a paramedic that even some doctors don't know how to do. So I'm on my own, out in the middle of a field, taking care of someone who had an accident. I don't have time to call and ask and wait for a response. I do. As a nurse, I gotta flip that switch now, and I gotta get orders from the doctor. But the experience that I've gotten as a paramedic comes in very helpful when I'm looking at a patient and I have a situation, and it's like I've been there before. I know what's going on. I know what the patient needs. I know what I need to do for them. And you know, frankly, in some situations, we just wait for the doctor to kind of catch up to us. You know, I already know what I need to do. I just need him to say, do it, and it's done. You know, in the classroom setting, that comes in great, because let's say they're talking about congestive heart failure, and you know, they're trying to explain what happens to the human body, how it affects, you know, what kind of signs and symptoms you're gonna see, what kind of medications, treatments, etc. Well, as a paramedic, guess what? Chances are you probably taking care of a patient who has congestive heart failure. So you know the signs and symptoms, you know the medications they take, you know what is going on in their body, you know about their heart rate, their blood pressure, you know what you need to do for them because you've done it so many times before. So as they're talking about it and explaining it, you already know what they're talking about because you've been there, done that, and went back for more. You know, and that's a great advantage that we have as paramedics going into the nursing over any other field. You know, yes, you know, you can have experience as a CNA or a VN or a medical assistant, and some of that experience will come in handy, but in our particular field, that experience itself, you know, is worth its weight in gold. You know, it'll put you and give you that extra edge above everyone else.
So although you have this double certificate, if you're in a hospital and you know what needs to get done and you know how to do it, you still cannot act because you have to wait for the doctor.
Correct. You know, and it's sometimes, again, we have to know when to turn that switch on and off, and we have to wait. And, you know, I know what's gonna happen, I know what needs to be done, but I have to wait when I'm working in the hospital as a nurse. You know, it's controversial, you know, for lack of a better word, when we work in an emergency setting, because they know we can do a lot of things and we have all that with us, but they kind of make sure that, you know, remember you're a nurse here, you're not a paramedic, you know, and we kind of have to always keep that in mind. And you know, it's almost like, you know, I like to joke around and say it's almost like you're bipolar sometimes, because, you know, you go up and down with those two mode settings that sometimes they kind of have to keep it straight all the time and know. But, you know, overall, it is a great experience to have that, to be able to always rely on whichever, it doesn't matter. And, you know, you never know when you're going to need those skills and that knowledge that you have. And it makes you, of course, more comfortable and more confident. And, you know, it's kind of like, hey, I've been there before. I know what that is. I know what to do. So, yes, ma'am.
How difficult is it for you to be working a full-time job and then in the EMT program or medical?
Well, it's
full-time job.
right. You know, a lot of, for example, a lot of the students here do that. You know, our schedule, for example, as an instructor and as a student, allows us some flexibility. The job that we may have also allows us that flexibility. So it's something like anything else, you kind of have to work it in, but it's possible. That's what is great about it, that you could do it. You want it, you can do it, you can have it. You know, you just have to, you know, figure out some things. And yes, you know, I have two jobs, like most of us nowadays, and it allows me for family time as well, because that's very important, you know, to have all that well-rounded off, you know, lifestyle. And well, it allows me to have some family time and spend time with the family and do the things that I like to do. You know.
You talked about shift work. What kind of shifts happen? And
It's all kinds.
yeah,
The standard shift work for EMS is a 24, 48-hour schedule. So you're on for 24 hours, you're off for 48. Some services have set days. So you're the Tuesday, Saturday guy. or the Tuesday, Saturday person. And that's your job. You come in on Tuesday, you work a 24-hour shift. You come in on Saturday, you work a 24-hour shift. So, you know, and those are kind of cool. I love I love set days. I love set days.
You know,
because I know what days I'm working, I know what days I'm off, and I can plan school, and I can plan another job around that. So set days are awesome to have. Now, and the good thing about it is if you're working a 24, 48-hour schedule, you're only working 10 days out of the month.
yeah.
You have 20 days off every month.
A lot of time to go fishing.
A lot of time to go fishing.
And making how much?
Well, that's another story, you know, it depends on the service you're working for, really. I mean, it really does, it's gonna depend on the service you work for. Like if you're working for the City of Brownsville is like one of the best paid, best benefited EMS services out there. It's a fire EMS, so not only do you have to be a paramedic, but you have to be a firefighter as well. And you have to be ready to do both jobs at any given time. So that's the kind of drawback to it, but like I tell my students all the time, the more somebody's willing to pay you, the more they want you to work. So yeah, the pay's good, the work's hard. Okay. Another place that's a good place to go work is Starr County Memorial Hospital, which is in Rio Grande City. They own their own EMS service. The pay there is really well. The benefits there are awesome. And their medics, if they're not on a call, they're working in the ER. So they don't get to go watch TV like some medics do. Not very many medics get to watch any TV anymore because the call volume is so high that you're busy all day long.
So my question really, because you get basic, intermediate, paramedic, et cetera, right? How easy is it for somebody to do the first level of basic and then be able to work while they continue? Is that a possibility?
That's a possibility. We have several people in this room right now that are EMT basics, and they are working as EMT basics. Some of them are working a full shift, a full schedule, which is 48 hours for us. EMT is considered full-time 48, or it's actually 40, so you get 8 hours overtime every week. So if their service pays overtime. So it just depends. I used to like working that because I knew I was getting 16 hours of overtime every time. And if I worked an extra schedule, that was all overtime. That was all time and a half. That was awesome. Because then again, I worked for city services. I didn't work for private services. Private services don't pay. Well, some private services pay better. They just work you less. Yeah. So, but Brownsville, they're going to start you off right at a 48, 50,000 a year, starting paramedic firefighter. Starr County, I really can't tell you, but it's pretty comparable to that. Along with that's without adding the benefits package in. You start adding the benefits package, your rate's going to go up about $10,000 a year. Okay. I also work for the city of Portisville, which is notoriously one of the lowest paid services in the valley. But what I liked about working in Portisville, people used to ask me, "Why are you working in Portisville?" I said, "Because we have all the cool toys." Portisville was the first service in the valley to have CPAPs on their trucks, which is a cool little device. It's awesome, especially if you're dealing with congestive heart failure or those drowning patients that have survived their drowning episode. We also were the second service in the valley to have interosseous injections. So we could go right into the bone if we couldn't get an IV going. So that was pretty cool. And we have brand new trucks every 10 years. We never keep a truck more than 10 years. So, and they don't have very many miles on them, and they're in great shape. So we have a lot of cool toys, and we have ventilators on our trucks and IV pumps, and it's really nice working in Portisville. We don't get paid much, but the toys were awesome. Just awesome toys.
Mr. Cortez,
Yes.
could you kind of wrap it up? Give us kind of a perspective, your perspective on the EMT program, and I know you wanted to say something else.
Well, one of the things that is extremely unique about our program is, as it's been mentioned before, after one semester, you can start working in the field, get real life experience. As we mentioned, the ladies and gentlemen that are here right now in this class are doing just that. So whatever you are talking about in the classroom, doing here hands-on, when they go to work, they get a chance to actually see it and maybe even perhaps do it when they're doing their clinical rotations. So it lends you to get into the field right away. And of course, be making money as you're working. Flexible schedules, set days, certain times of the day even. You know, I work evening shifts, mid-morning, early morning shifts from 4 a.m. to 12 noon. You know, that's 8 hours. And you get to go home after that, you know. So the experience, the education comes in very handy. If you want to pursue this field or go into any other field, we've got students that have gone through our program and are in PA school over at UT Pan Am. We have a student who's in medical school over at UT Health Science Center San Antonio. We've had you know, a lot of other individuals come through this class and move on to other programs. Nursing, a ton of those students have gone through here as well.
Some have gone to art, respiratory therapy.
Respiratory
some have gone
therapy.
to physical therapy assistant. Some have gone to occupational therapy.
So you know, it gives you that opportunity that it opens a lot of doors for you. You can use it as a stepping stone, or you can make a career out of it. You know, I myself have been doing this over 20 years. Started out as a paramedic. I'm now a registered nurse. I consider myself a paramedic first and always, you know, even though I'm a nurse too. But you know, I've loved everything that I've done and experienced in this field, everything that I've learned, and I'm glad I decided to do this program. I went through this program here at this school too. You know, you can date back when this institution was TSTC, then it became STCC,
My
and
basic
then
was
it
through
became
TSTC.
STC. So I've not only been here as a student that long, or throughout the different, you know, phases of the school, but I've also been teaching that long here as well. You know, from when this school was STCC all the way till now. You know, I think this is my 18th year, no, yeah, 17th year of teaching here at STC now. So, great opportunities that this field opens up for you, gives you a lot of insight into many other fields that you can study. And it's something that, as I've mentioned to the other groups before, it's an education regardless of what you have or what you're going into. And that's something nobody will ever be able to take away from you. You can take away your car, your personal belongings, your house, but not your education. You take that with you wherever you go and you decide what's next. You decide to use this as a stepping stone and go for whatever's next in your plans. And we're here to help you. We're here to answer any questions that you may have, whether they're specific to this program or any other program. I'm sure we can help you, point you in the right direction. And I hope that you guys got to learn and see something different from our program than perhaps what you knew our program had to offer for you.
Well, it's been nice here chatting with y'all. Hope we answered some questions. If you have any further questions, come see us. We're always available and always open to questions. See us walking down the hall. As long as we're not busy going to class, we'll stop and chit chat with you a little bit. So come and see us. If you're interested in the program, see our administrative assistant for an appointment for advisement. So we'll be happy to get you started. Thank you very much.